In a recent Senate hearing, RFK Jr. faced intense questioning over his shakeup at the CDC. This analysis features 3 stunning clips of CDC failures in 1947, 1976, and 2021 as context for the dramatic changes. This 1947 video questions public trust in government, referencing a 1947 polio program involving DDT, a chemical banned in 1972. This historical context raises concerns about past public health decisions and their long-term impacts, prompting reflection on current practices.
With the possibility of a serious infantile paralysis epidemic, health authorities of the city of San Antonio, Texas, attacked the germ carriers throughout the city. With the war-discovered DDT in special sprayers, sections of the city are blanketed with the insecticide in the fight to stop the spread of the dread poliomyelitis. Every suspected spot is sprayed.
RFK Jr. delivered an opening statement addressing the recent shakeup at the CDC. His remarks focused on transparency and accountability within the agency, emphasizing the need for reform. This statement sets the stage for ongoing discussions about public trust in health institutions.
Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality.
A 1979 60 Minutes segment revisits the swine flu vaccine fallout of 1976. The interview with CDC Director David Sensor explores the challenges faced during the vaccine rollout. This historical perspective provides insights into the complexities of managing public health crises.
Remember the swine flu scare of 1976? That was the year the U.S. government told us all that swine flu could turn out to be a killer that could spread across the nation. And Washington decided that every man, woman, and child in the nation should get a shot to prevent a nationwide outbreak, a pandemic. Well, 46 million of us obediently took the shot. And now 4,000 Americans are claiming damages from Uncle Sam amounting to $3.5 billion because of what happened when they took that shot. By far the greatest number of the claims, 2/3 of them, are for neurological damage or even death, allegedly triggered by the flu shot. We pick up the story back in 1976 when the threat posed by the swine flu virus seemed very real indeed.
Well, this year you can get protection. The vaccines are safe, easy to take, and they can protect you against flu.
Dr. David Sensor, then head of the CDC, the Center for Disease Control in Atlanta, is now in private industry. He devised the swine flu program, and he pushed it.
There had been cases in Australia that were reported by the press, by the news media. There were cases in...
None confirmed. Did you ever uncover any other outbreaks of swine flu anywhere in the world?
No.
Flu vaccine had been tested. What it didn't say was that after those tests were completed, the scientists developed another vaccine. And that was the one given to most of the 46 million who took the shot. That vaccine was called X53A. Was X53A ever field tested?
I can't say. I would have to...
It wasn't.
I don't know.
Ever come to you and say, you know something, fellas? There's the possibility of neurological damage if you get into a mass immunization program.
No.
No one ever did?
No.
Do you know Michael Hatwick?
Yes. Mm-hmm.
Dr. Michael Hatwick directed the surveillance team for the swine flu program at the CDC. His job was to find out what possible complications could arise from taking the shot and to report his findings to those in charge. Did you know ahead of time, Dr. Hatwick, that there had been case reports of neurological disorders, neurological illness, apparently associated with the injection of influenza vaccine?
Absolutely.
You did?
Yes.
How'd you know that?
By review of the literature.
So you told your superiors, the men in charge of the swine flu immunization program, about the possibility of neurological disorders?
Absolutely.
What would you say if I told you that your superiors say that you never told them about the possibility of neurological complications?
That's nonsense. I can't believe that they would say that they did not know that there were neurological illnesses associated with influenza vaccination. That simply is not true. We did know that. I've said that Dr. Hatwick had never told me of his feelings on this subject.
Then he's lying.
I guess you would have to make that assumption.
Then why does this report from your own agency, dated July 1976, list neurological complications as a possibility?
I think the consensus of the scientific community was that the evidence relating neurologic disorders to influenza immunization was such that they did not feel that this association was a real one.
You didn't feel it was necessary to tell the American people that information?
I think that over the years we have tried to inform the American people as fully as possible.
As part of informing Americans about the swine flu threat, Dr. Sensor's CDC also helped create the advertising to get the public to take the shot. Let me read to you from one of your own agency's memos planning the campaign to urge Americans to take the shot. The swine flu vaccine has been taken by many important persons, he wrote. Example, President Ford, Henry Kissinger, Elton John, Muhammad Ali, Mary Tyler Moore, Rudolph Nureyev, Walter Cronkite, Ralph Nader, Edward Kennedy, etc., etc. True?
I'm not familiar with that particular piece of paper, but I do know that at least of that group, President Ford did take the vaccination.
Did you talk to these people beforehand to find out if they planned to take the shot?
I did not know.
Did anybody?
I do not know.
Did you get permission to use their names in your campaign?
I do not know.
Mary, did you take a swine flu shot?
No, I did not.
Did you give them permission to use your name saying that you had or were going to?
Absolutely not. Never did.
You're in charge. Somebody's in charge. It's been 3 years now since you fell ill with GBS, right?
Right.
Has the federal government, in your estimation, played fair with you about your claim?
No, I don't think so. It seems to be dragging on and on and on. And really, no end in sight that I can see at this point.
CDC Director Rochelle Walensky's infamous false statement that COVID-19 vaccines prevent infection and transmission highlights the continued credibility issues with the CDC that have persisted for decades.
And we can kind of almost see the end. We're vaccinating so very fast. Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials, but it's also in real-world data.
We, Research You, decide if RFK Jr.'s assessment has historical context.
Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease.